medium size. Give me a second, okay?
Thank you.
Just going to quickly wipe it for you. Okay, come forward, just a chin rest. Just going to quickly adjust the eyes for this one. Okay.
So we're doing corneal OCTs, aren't we now?
Yes. Okay, look straight ahead. Okay, now take a couple of blinks. Okay, and keep your eyes nice and wide now and try not to blink. Okay, and you can blink as normal.
That's the cornea of your good eye. That's the one that hasn't got advanced keratoconus.
Both my eyes are good.
Okay, I'm going to move to your left eye now, okay? Okay, again, look straight ahead for now. Take a couple of blinks and keep your eyes nice and wide again and try not to blink.
So this is the
And you
cornea.
can rest back.
This is the cornea of the left eye, which has got a bigger cone.
Okay, perfect. You should be all done for now. Just
Perfect,
continue
thank you.
back in the waiting chair, okay?
Yeah.
Thank you very much.
Right, so you remember when you done the scan last time, we
Yeah.
decided you needed cross-linking in both eyes,
Yeah.
and today we're doing both eyes. The way we do it, we do just separate, so one eye and then second
Okay.
eye. So that's it. We done the scans. The reason I did the scan this morning to check that your cornea thickness
Okay.
and see which type of riboflavin I'm gonna apply for the eye.
Yeah.
And I'll explain to you in a second what we've done. Okay, let me have a look first of all, make sure all is good.
They did the OCT of the cornea.
Ophthalmometry, OCT, yeah. Just this is the most accurate way to measure the cornea thickness.
Okay. We did that at work as well.
Yeah.
We didn't know exactly all the numbers we were looking at, but we did them yesterday.
Yeah, I'll show you those. Okay, just look at my ear straight. Good man, that's good.
Are his eyelids any better today?
His eyelid looks so far here, but we do always better to do what's called manual expression of the glands to see what's like, but they're not looking inflamed anyway. Yeah, like we've seen the signs of keratoconus. Left eye is worse. You got those vucts lines
Oh, is
in the
it?
cornea, the special lines of the cornea. Look up for me now. That's good. We have a healthier oil serum coming from the glands. Okay, good. That's fine. Thank you. Okay, so we're all good. The eye looks healthy to me to proceed.
Perfect.
So what we're gonna do, just explain to you. So obviously this is the eyeball,
Yeah.
this is the cornea, this is where you have the keratoconus, the cornea is funny steep shape. So I'll just take the cornea off just to explain. So the way we do it is called epi-off, meaning I'm just gonna wipe the skin of the cornea.
Okay.
And I use a very special ethanol to soften the skin. I don't use any blood or anything to worry
Okay.
about. Just a bit of soften it, and then I have a sponge to wipe it off nicely.
Okay.
Okay? And one that's good, first of all, why are we doing EP-off? Because it's more effective, definitely.
Okay.
So the success rate is very high. All the
Yeah.
figures we talked about, 90% success, all that with EP-off. If we
Oh.
keep the epithelium on or the skin on, the success rate dropped.
Oh.
So that's why I wouldn't recommend
You
it.
take it.
Especially if there's enough thickness in the cornea to allow this to be done. So once I remove that skin off the epithelium, then I'll set up everything and we start putting drops called riboflavin. So it's like a vitamin B which soaks the cornea. And we keep doing that pattern. Every couple of minutes we put drops and drops and drops until get to 20 minutes where I measure the saturation, how much riboflavin in the cornea, that's important. And once I'm satisfied with everything, then we start the treatment with the cross-linking.
Oh, okay.
And it's called accelerated cross-linking, meaning it's a shorter time rather than the usual standard 30 minutes. It's the same outcome, the same benefits, and the same safety profile. So it's going to be 10 minutes of the UV light. Once that's done, I wash everything, then I will put some drops, antibiotics, steroids, etc. And then put the bandage contact lens. The contact lens, you don't touch it, you leave it in the eye. This is like a bandage, as the name says, just to make your eye comfortable. And that's for the next 4 or 5 days. See you back here. I'll take the lens off, make sure that all cornea heals nicely. That means we're good.
Okay. Perfect.
And then we just observe the results on the long term.
Yeah.
In the next 3-4 days, the first 2-3 days is gonna feel a bit uncomfortable. So most people say they're feeling burning sensation,
Okay.
or you might feel gritty or something in the eye. If the eye waters or you feel like you like to keep them shut, it's fine. Just keep your eye closed to avoid the bright lights. That will be comfortable. I'm gonna give you some painkillers.
Yeah.
It's keep the pain down. They work on the corneal nerves. That's where the pain happens.
Yeah.
But if you use the drops, if you use the painkiller I'll give you, you'll feel much
Yeah.
better.
Okay.
If you need to top up with your own painkillers, things you take like paracetamol, ibuprofen, it doesn't matter. You can do that the way you do normally.
Perfect.
Okay, so it's nothing different. But it shouldn't be really that uncomfortable. Yes, it's gonna be first 2 days a bit of say indoors. After that, it's easier.
Sure.
Good. So this is the treatment. When we go home, we do, as I said, the 2 eyes, one eye, then the second one. When we finish, you go home with all the package, all the drops. We give you everything provided to you, so you don't have to do anything. All you need just to start using the drops yourself.
Okay.
So do you have any question for me?
No.
All good?
Yeah.
Right. Okay. You're not meant to feel much. It's very easy surgery. It's only feel water dripping on the eye. I numb the eye a lot of times throughout the procedure. Just when I have a special clamp, so we put more numbing drops. I put a sticky drip to cover the eyelashes. Then if you want to blink, you can blink. It's not gonna affect me because the speculum holding the eye open. And if you feel any pain, please talk to me. Tell me. You don't have to be brave. just say, and I'll make sure that you're comfortable. It's not gonna be long, but it just the drops takes time. We don't have to keep that speculum on all the time. Just initially, and then when we do the UV light exposure. But when you put the drops, I take it off, so it's easier for you.
Okay. Perfect.
Okay. So not much to do. Just stay still, looking at the light in front of you, which is like flashing light, orange light when you do UV light. After that, just looking ahead. Okay.
Okay.
Good. If you need anything else, I'll speak to you. Take you through it.
Perfect.
All right.
Yes.
Good. Let's go then.
Can I get these to come with me?
Yeah. Before the operation, we do this scanning. This is your cornea, and this is the total thickness of the cornea, and this shows you the epithelium, that the skin of the cornea thickness as well, and that helped me to decide what treatment I'm doing, because depending on the thickness of the cornea and the nature of the epithelium. You can see your epithelium. This one, it's got multiple colors because it's thin and thick and etc. And there's a lot of thinning here compared with the thickening here. Same story here. You can see it's interesting actually. Show you the thinning here. So that is where the cornea thin, right? And when the cornea thin here because of the keratoconus, the cone is there. So the epithelium is very thin compared with relatively thin. So you see here it's thicken outside the cone and thin on top of the cone. So cherry with this, detecting keratoconus with those things. Epithelial mapping is really good thing now.
That's the right eye, isn't it?
That's your left eye, the worst eye.
That's the cone one.
The right eye is better shape because actually the cone is more central. Here is off center. Good.
Yeah. I'm alright, but I'm a big man at it.
Left eye first, right eye first.
I don't know.
That's good. And what treatment we doing for you today?
Cross-linking.
Which eye?
Both eyes.
Both eyes. Any allergies that need to know about?
No.
Okay, good. So we're all good to go. We're gonna start doing your right eye first. As you can see now, I covered your left eye,
Yeah.
and we're focusing on the right eye first. Okay. You're gonna have a lot of eye wash like this. Cooling water, like an under shower eye bath, yeah? Look at the green light for me. Good man. Just enjoy the music. Don't have to worry about anything here. Cooling water, shouldn't be too much. Good man. We're going to brighten the light a bit now. So now I want to soften the skin. Do you remember we applied that ethanol? So I'm going to press on your eyeballs for 35 seconds. Okay, look at the green light all the time. And be careful by not looking around, space the light. Good, very still, very still. Your eyes nice and open, yeah? So we're trying this for 35 seconds. You're really good. You're really well here. A bit of eye wash now. On the green light for me. Flash the green light. Good. So now that softens the skin. I'm just gonna move it to the side. On the green light. Good. So this part one finished. It's gonna be easier. I'm just gonna start some drops now. Not just a drop. This is called riboflavin. That's a vitamin B. It's soaking the nice. And timer on now. And we're gonna put these drops every 2 minutes. Good. I'm gonna take this off. Make it easier for you. All right. Good. Open your eyes. Good. So you can keep your eyes nice and closed. So now you know opening drops every 2 minutes, okay? You can stop. It's gonna be now flipping this out. Okay, open your eyes a little bit. Good. Let's put this more. Good, so timing is off now. You can open your eyes a little bit. Look down for me. Good. Down. Good nice. If it starts to burn or sting, just let me know, alright?
Yeah, it's stinging right now.
It's a little bit?
Yeah.
Yeah, just put some. Open your eyes now. Good. Okay, make sure your head straight, chin up slightly, no, chin up, that's it. So, you can't capture this here, you must capture it here, yeah? Okay. Okay, I'm gonna measure the cornea thickness, alright? So just stay still for me. So we got 537 micron, that's good. Just do one more. So around the cone. Still 588. Okay, we're gonna export that now. It's a light. Ladies do it all the time. Sunbathing, except this time for the eye. We need to get this closer. eye. So tell me, do you see orange light there? I'll bring it to you. Closer. Yeah. Now I want you to stay looking at that orange light. So you want to check it high. So this is a 9mm treatment zone I'm gonna go for. We have a pupil tracking on, so actually it track pupil. And you see the orange light, right?
Yeah.
That's your target. Looking at the orange light all the time. Just double check the distance between the UV light and the eyeball. Should be 50mm, and it is. Drop speed. Yeah. So a lot of water on this, yeah? Look at the orange light. Good. We're gonna start, okay? So that's it, just a light. You see that your eye exposed to light all the time?
Yeah.
Good. So actually your pupil tract, if you move, it will pick it up. And that's gonna be another 9 minutes. Less than 9, so it's actually in a second. I may have to adjust your head, make sure that you always straight. Yeah, you see, it stopped because you moved, you see? Now back chin down a bit, that's it, it's recognized. Yeah. Well, you relax, let me just adjust your head, that's it, yeah. Now. Yeah. Yeah, you're moving, you see? Try to move less. On the orange light, okay? Is that difficult?
That's okay.
No, it's good. I know it's boring to be like that for 8 minutes, but that's what you need to do. Good. Control is gonna be. Good. You've done very well now. Okay? So we're gonna move this back. So now when you have on the sun, you want to cool the eye a little bit, okay? So a lot of eye wash, yeah? It's cold water, intention is cold. Look at the flashing blue light, do you see it again? Good. That's intentionally cold water. Calm down any inflammation, cool down that tissue which has been heating up, radiating for the last 10 minutes, yeah? Good. Then antibiotics now, on the cycle. Yeah. Oh, no. Put contact lens now. Okay. Look at the green light. Good. In now. Lens in. More drops. Check this and more again drops. Gonna stay fresh now, look at this. Okay, so that's done. Open your eye, checking the contact lens in nicely. Look down for me. Yeah, try to squeeze your eyes and sitting alright. Just good. There we go. Okay, again, if you open your eye, I'm gonna put the drops. Keep your head in the middle, yeah? Good. Stingles, okay.
Things are fine, you know.
Yeah, if you want to move your head a bit, it's fine, so you don't feel stiff neck. You have time now. Stinger is okay now.
That's okay, yeah.
Okay, let's put one of those other drops. So they work different ways to make sure the eye is not so nicely. You see, you didn't feel anything, right?
No.
So that's the beauty about it. It's minimal sensation, really.
Yeah.
It's not a painful procedure at all. It saves your eyesight.
Exactly, yeah.
Okay, so I'm gonna cover your eyelashes now again with a sticky drape. If you look towards me, open your eyes. I think you're moving your head like that. Okay? Yeah, look up towards me here. Good. Just cover your eyelashes. Up here, at me. More up towards me. Good, more. Okay. This is the flashing green light for me.
Yeah.
Let's do it. There we go. I'm gonna help you. Relax. Good. Okay, so far, just relax and go. And step across now. So we don't have to guidelines. Look at the green light for me. Water, cool water. That's very good. More. The green light. Good. Chin up for me now. On your eye now. So that's it. Nice and shiny. We'll just check. That's finished part one. Now let's start with the info. remove that flash. Look at the flash in real life. More drop. You know, sometimes the second eye has different sensation.
Yeah.
One is your brain now used to what
Yeah.
to expect, try to search for other things, right?
Yeah.
So you get different feeling and you consider different things. Okay, so let's try now. You want this? Yeah. You have to look outside now, right? Good. Saturday. Sorry, one down here. Tuesday I have a big rock. Tuesday I have a big rock. Tuesday I'm flying to Abu Dhabi in the evening. But it's only with big rocks.
So you guys are then flying?
Yeah. I couldn't fly another day, so only issues was the drop the first one, then finding the timing. But if they come and use the drop, they don't the eye for like 20 minutes, half an hour. Then you can use the same one again and again easily. But the more you use, the slower the healing. So you're slowing out the healing. So try not to use unless you really have to. And you have the antibiotic drops obviously and the steroids. Be careful about those use of antibiotics for infections if you have in both eyes. Loads of antibiotics drops, procedure and septic, so chance to catch infection from here is really rare. Good. So again, we're going to wash the eye, lots of water, yeah. Keep your eyes open. I'm going to put more numbing drops. down. We check the contact lens position. I'm going to check the contact lens position better as well. Perfect. So, all done. Went so well. Once all that green done, go to your halt now. Converting. Okay, so you might notice your pupil large. I put cyclodrops at the end, so this to dilate the pupil, relax the muscles, so it's not so sensitive to light. Okay, but make sure you get sunglasses or something when you leave the clinic. Yeah. Yeah? So this is sensitive to light now, that's normal. Okay? Best thing to do, go rest your eyes, keep your eyes closed, eyes
Yeah.
closed, and you'll be fine.
Okay.
Okay?